Hello everyone, today the chapter is about the syndrome differentiation. About the syndrome, disease, and symptom, we had to give a detailed explanation in the front. So today now we go to jump into this kind of detailed information. The first one I want to introduce to you that is the 8 Principles Syndrome Differentiation. Syndrome differentiation, as we had talked, the syndrome is the most important analyzed process of diagnostic of TCM. Those include the 8 Principles Syndrome Differentiation, Qi blood body fluid syndrome differentiation, 脏腑 organ syndrome differentiation, meridian-based syndrome differentiation, and also the syndrome differentiation of etiology, 胃气营血 differentiation, and the Sanjiao syndrome differentiation. Among those differentiation, we will introduce some selective in here. The first one, 8 Principles Syndrome Differentiation, is a method which identifies the nature of disease based on the information collected from the 4 diagnostic methods. It differentiates the disease location, like exterior or interior, its nature, like cold or heat, the confrontation level between the healthy qi, 正气, and the pathogenic qi, 邪气, and also the yin or yang category. The 8 principles are the general guidelines obtained from the characteristic of a specific some syndromes. For example, like the exterior and interior. They are the basic principles guiding practitioners to determine the location of a disease. The cold and heat, deficiency and excess are the basic principles used to understand the natures and the situation of a disease. Yin and Yang are used to tell the overall category of a disease and serve as the general guiding principle among the 8 principles, which generalize the 6 principles of exterior and interior, cold and heat, and deficiency and exercise. The significance and the limitation of 8 Principles Syndrome Differentiation is that it can guide the treatment by helping to understand the fundamental features, determine the category, and predict the trajectory of a disease. Therefore, the 8 syndrome differentiation method is used to analyze the commonality of all kinds of diseases. The first principle of 8 syndrome differentiation is exterior and interior syndrome, which used to determine the location and pathologic changes of disease. Generally speaking, the skin, body hair, muscle, meridians are located on the outside of the body, so they belong to the exterior. The blood vessels, bone marrow, and the 脏腑 organs are all located inside, so they belong to the interior. The external contraction of the pathogenic factor in the superficial portion of the body is an exterior syndrome, while pathologic change in the 脏腑 organ is an interior syndrome. Judging from the tendency of a disease, if the pathologic factor transmits from the exterior to the interior, it indicates the deterioration of the disease. If it transmits from the interior to the exterior, it indicates the improvement of the disease. It is the very basic understanding of stages of external contracted diseases. Exterior syndrome appears when pathogenic factors such as the 6 pathogenic factor and the pestilence invade the body. The 胃气 fights against them at the superficial level. The clinical manifestation including acute onset of aversion to cold with fever, headache, body pain, stuffed and runny nose, slight coughing or panting, normal tongue manifestation, and floating pulse. This is because the 胃气 fights against pathogenic factors at the superficial level of the body. It feels too warming, so leads to the aversion to cold. And the qi moving becomes constrained by the pathogenic factor, which causing headache and body pain. The lung, which guards the skin and body hair. So when the pathogenic factor invade the skin, they affect the lung with the lung failing to diffuse. So coughing or panting appears, and also about like the body hair, the skin changes. Because the pathogenic factors has not been transmitted inward yet, so the tongue manifestation is normal. Since the pathogenic factor fights against which at such a superficial level, the versus qi is aroused, so it appears as floating pulse. In other terms, acute, light, short period, aversion to cold, heat effusion, floating pulse are the key distinguish points for external syndrome. The corresponding syndrome of exterior is the interior syndrome. It refers to the interior physiologic changes, with the zangfu organs, qi, blood, and bone marrow involved. The clinical manifestation cover a wide range. We will have the detailed explanation in the zangfu syndrome differentiation chapter, but we should know the three causes for this syndrome. The first one is the transmission from the exterior syndrome. The second results when an exogenous pathogenic factor invites the zangfu organ directly, which called 直中, that is, straight attack. The third is due to emotion injury, improper diet, or overwork. All of these three causes may impair the qi and blood of the zangfu organs, or cause functional disorder of the zangfu. The symptoms and mechanisms has many different reasons, but the key is the dysfunction of the zangfu, qi, blood, and body fluid. There has another syndrome which is called half exterior, half interior syndrome. It is the pathogenic qi and healthy qi are fighting and lingered between the exterior and interior area, manifested as alienative, chills and fever, distress and fullness in the chest and hypochondria. In the chat, we had listed the information about the three location syndromes. You can have a look. The second aspect of 8 Principles Syndrome Differentiation is the nature of the disease. That is cold and heat differentiation. From the Yin Yang theory, we know that the cold and heat are two principles used to identify the specific natures of a disease. Pathogenic factors also can classify into Yang and Yin in terms of their nature. Healthy qi is also divided into Yang qi and Yin fluid. In fact, cold and heat syndrome reflect the growth and diminishment of Yin and Yang in the body. A cold syndrome reflects predominance of Yin cold or deficiency of Yang qi, while a heat syndrome reflects the preponderance of Yang heat or deficiency of Yin fluid. So the cold syndrome mostly caused by the invite of the pathogenic cold, or the Yang deficiency with excessive Yin cold gathered, manifested as aversion to cold and preference for heat, absence of thirsty, clear and thin sputum, saliva and a nausea discharge, loose stool, pale complexion, and a pale tongue with white and moist coating. The pulse is tight or slow. If we using one word to describe it, that is white, which refers to the clear pale manifestation in those syndromes. The heat syndrome was caused by an invasion of the pathogenic heat or experience Yang qi in the zangfu organs, or in deficiency with Yang hyperactivity, manifested as aversion to heat and a preference for cold, sweating, thirsty, red face, yellow and dry tongue coating, rapid pulse. The characteristic using one word, that is red. The third aspect is deficiency and excess syndrome differentiation. About the deficiency and excess, I think we had already explained it in the pathogenesis chapter. They are the principle to identify the growth and diminution of the healthy qi and pathogenic factor, reflecting the power of them in the patient's body. And we know in the deficiency syndrome, it is caused by the deficiency of yin, yang, qi, blood, body fluid, essence. We can characterize it into a situation, deficiency and decline. The patient always complains aversion to cold, weakness, less lustrous complexion, tender tongue with less tongue coating, and deficient. Pause. Why the excessive syndrome, which caused by exogenous pathogenic factors or the accumulation of the pathological products resulting from the imbalance of yin, yang, qi, and blood. An excess syndrome results from two aspects. First, it occurs when 6 pathogenic factors, or pathogens or toxin, invites the body. Secondly, the functional disorder of the lymph organs leading to pathological products such as phlegm, dampness, retentive fluids, blood stasis, or food retention. Clinically, the manifestations of excess syndrome are characterized by excess and retention. Here we come to the last principle, Yin and Yang syndrome differentiation. The Yin and Yang are the general principles in the 8 principles, which can classify all syndromes into Yin and Yang, these two sides. Like the exterior, heat, excess, they belong to the Yang syndrome, while the interior, cold, deficiency, corresponding to the Yin syndrome. They too are the guidelines for another 6 principles. We should know that each principle in 8 principle differentiation just sum up the pathogenic condition from different aspects and only can indicate some abstract characteristics of the disease instead of a detailed picture. So in actual clinical practice, those principles are the compass for guiding the correct direction. We still need lots of detailed differentiation method for help. So this is about the introduction for 8 principle syndrome differentiation. Hope you can get it. See you in the next chapter. Bye.